Hello and welcome to our channel Nuturemite, where we provide informative videos regarding health and lifestyle. Please like, share and subscribe the channel and click on the bell icon for important notification and videos.
Pregnancy in women in 30s, risks and solutions. Family planning may take a little time for some couples and especially for couples married in their late 20s. So conceiving for these women happens in the early 30s or mid 30s. As a matter of fact, there might arise a question in young couples' minds whether conceiving in their 30s is safe or not. Well, there might be several difficulties related to late pregnancies, but the mother's health is what matters. To put it differently, if the mother is healthy, in most cases, the newborn also stays healthy and faces fewer difficulties. Risk. Stay healthy, dad. Sometimes the father is also responsible for unhealthy newborns. If the father is a chain smoker or a heavy drinker, then in many cases the newborn might be unhealthy. Studies found that fathers to be increase the risk of congenital heart diseases in their offspring, so it is preferable for these fathers to quit smoking. Women in 30s, age matters. A couple who want to conceive in their early 30s is always advised to consult a doctor before conceiving. It is because when a woman reaches their 30s, they tend to have many changes physically as well as emotionally. A mother's age is a factor and plays the main role in pregnancy. As her age increases, she may be prone to many abnormalities regarding pregnancy. A woman's age is responsible for a baby born with Down syndrome as the risk rises from 1 in 1250 at the age of 25 to 1 in 100 at the age of 35. Chromosome count. From the baby's perspective, the genetic material might have an abnormal number. There might be an abnormality in the pairing system as the couple's age increase, and that results in miscarriage in the early stage. There increases the risk of chromosome problems which might lead to miscarriage sometimes. In most of the cases, the mother faces miscarriage due to chromosomes that did not replicate properly. This naturally happens in the first trimester. The mother has to keep herself in a proper diet and should follow certain medications prescribed by the doctor. Studies reveal that most of the US citizens conceive in the later years of 30 due to their career or family planning, which ultimately results in high risk during labor due to their age. You are never late if you follow right. Consult a doctor. The mother has to check her health regularly if she is willing to conceive. Today's medical science is quite advanced, and so these issues can be solved in major cases. Most women in their 30s are prone to gestational diabetes and hypertension. They are recommended to avoid excess salt and sugar. Undergoing medical test. During pregnancy, there are certain tests that doctors offer to all pregnant women. Doctors perform genetic screening to mainly check if the baby is suffering from Down syndrome. The doctors prefer to do an anatomy ultrasound test to check if the baby has all the body parts. The doctors do this test is done at the stage of 18 to 20 weeks to all pregnant mothers. But for older mothers, doctors recommend a special test. It is the growth scan in the time of middle to the third trimester. If the mother is 40 years of age at the time of delivery, then they also offer and recommend fetal monitoring in the last month of the pregnancy as the age is too high for a healthy pregnancy. Keep yourself fit. There is no doubt that pregnancy brings a lot of changes in the body and in mind of the mother. Staying fit at this stage of life for mothers is an important task. A regular exercise may decrease the probability of pains and aches and bay, and mothers prefer having a healthy diet. The baby's health also depends on the mother's health. In other words, if the mother stays fit, the baby also stays healthy. Emotional stress happens due to hormonal changes, and this rate rises when a woman is pregnant. Family members can handle this to some extent with good care. Women in the 30s are prone to more risk. Give a healthy birth. Studies prove that women in the 30s who gave C section birth to their babies were 4 times more likely to have complications than mothers who gave vaginal birth. Mothers 35 or older who had C sections without first going into labor were 5 times more likely to have severe complications than the mothers who gave vaginal birth. So, according to WHO, C section birth should only be operated in the time of high risk factors regarding the baby and the mother. The rate should be 10 to 15%. But nowadays, most of the couples prefer C section births as it is less painful for mothers due to a high dose of anesthesia. Mothers above 30 years of age may develop risk in their labor time, but vaginal birth is more preferable and natural. The whole process of pregnancy occurs under the influence of hormones, and hormones are best active between the age of 15 to 30. That does not mean that women conceiving after 30 might face a lot of problems or they might not able to conceive. The point is, it is better advised by doctors that conceiving before the age of 30 gives hazardless pregnancy.
Thank you. Please like, share, and subscribe to the channel. Click on the bell icon for important notifications and videos.